I think that it's twofold. One is outside of the business model, right, healthcare globally, and then the other one is inside the business, inside our hospital. I think there's a lot of dissonance between the leadership and the executors in innovation, whether that be us, manager of innovation, or our champion physicians who are wanting to create change, who see the problems that need to be resolved and have their patient's ear. I feel like those are the two big kind of disconnects.
I think that the biggest issue is getting consensus. Everyone's coming at it with different understandings. Some people think the future is way far out, others think it's happening right now. And people have different understandings of what that means. So even just getting consensus on basic understanding, let alone what to do about it, is a challenge.
Some of the challenges for business model innovation in healthcare is the fact that many systems have gotten used to how they run their business. We know how to make appointments for patients, we know how to refer patients to specialists, and then something comes along like virtual care. And suddenly patients go online, they have the visit online, they might even be referred to a specialist that's a couple of markets away that you might not have even thought of. It's a new way, it's a new world, and it's a world that we have not been trained to lead in or trained to compete in.
So business model innovation is really, really hard, and that's why I think it's healthcare's unfinished business. We've never really had pressure to do it. So there's two levels of challenge. One is, as we've been hearing, there's four components to a business model, right? The value proposition, the resources, the processes, and the profit model. Well, when you're in the territory of business model innovation, you're hitting on all four at the same time. Most healthcare systems can barely just do one of those, like a process innovation or just a value prop. So you're asking a system that doesn't even know how to do one of those well to do all four at the exact same time. So that's why, one, it's hard from an organizational perspective. And then you layer on, you can't change those apart from the other stuff around your own organization. And usually there's two big areas that get in the way. How people get paid. So particularly in a publicly funded system like we have in Canada, changing the business model means changing policy because you have to change what gets reimbursed, and that's not easy. And then the second thing is it changes how people work. Well, you now want to change how a doctor or a nurse does their job. Well, you got to go back and change years of college and education and residency. So you can't just change people's job because you want to. So those are all the barriers against this stuff.
There are a lot of barriers, and I think that we haven't built the resilience yet of people doing innovation, and it's a skill that we learn. So we hear a lot of, oh, that's really cool, but, and people stop. And part of my job is to help people learn how to move around that and to find ways to yes.
I think there's a lot of external forces that, provide some challenges, such as regulation, like I was speaking to before, that can inhibit. Money is always a factor, and something I alluded to before is innovation theater. It's something that you see trending a lot, where a checklist is actually kind of being created for what innovation is, such as opening a center or getting a team up. But other than dipping your toes in the water, truly being innovative and using some sciences of innovation to come up with successful solutions is really important.
I think so I'm going to start with saying cost center. We have different departments that specialize in different services that are all together geared towards healthcare. To create alignment amongst these different divisions in a innovative mental framework way, as well as in a fiscal manner, it's very difficult to create. alignment, and I'd really like to see that transformed in order to move forward a lot of our items on the innovation agenda.
With digitization, we're taking our protocols, our care plans, and making them digital, and then trying to scale them across many different clinical areas. To do that means consensus. That is one of the big challenges right now, is getting consensus across many care groups and clinicians. So that's one of the big challenges there.
So a design challenge that we are just about to start pursuing is to redesign the experience of an in-home visit. So we do home care, so we do 10,000 home visits a day. And the experience of that for both the personal support worker showing up in the house and the patient receiving care in their home hasn't really been touched in many decades. So we've just partnered with one of Canada's top design innovation firms, and they're going to help us redesign the end-to-end experience of home care. And a lot of what I learned today will be brought into that.
For me, it is really about teaching human-centered design and helping people integrate that not only into the way they create projects, but how they live their lives and how teams are run for healthcare. And I'm slowly beginning to see that. So part of my job, every time I do a workshop, I train 2 other people. So we now have 20 trained people who can now work, and hopefully next year we'll have 40, and then we'll have 60. So that every site will have someone teaching this process.